I'm Dr. Marta Tejedor, transplant hepatologist at the University of Iowa, and I wanted to share with you the fact that alcohol interacts with cardiometabolic risk factors in the progression of liver disease. What does this mean? It means that any of those things separately can make your liver disease progress. But when we combine them, they don't just add their effects, they multiply their effects. So recent studies have shown that the number of people who have significant fibrosis in their livers are greater if they have a combination of cardiometabolic risk factors and alcohol consumption. Let's just quickly go through those cardiometabolic risk factors: obesity, diabetes, high blood pressure, and high cholesterol. The more risk factors, the more cardiometabolic risk factors you have, the more likely some alcohol is going to worsen your liver disease. Therefore, we know that if you only have one cardiometabolic risk factor and you also drink a small amount of alcohol, the prevalence of liver fibrosis is going to be around 3%. But if in the presence of one cardiometabolic risk factor, you drink more, like 15, 20 units per week, that prevalence is going to go up to 15%. Likewise, if you drink very little, but you have a greater number of cardiometabolic risk factors, that prevalence of significant fibrosis is also going to be around 15%. And what happens if we combined a big number of cardiometabolic risk factors with a significant alcohol intake? Then the prevalence of significant fibrosis goes up to 30%. I'm just sharing this information to help you make an informed decision about how you want to interact with alcohol. There is no safe amount of alcohol. Even so, smaller amounts with a lower number of cardiometabolic risk factors are safer than greater amounts of alcohol with greater number of cardiometabolic risk factors. And finally, I just wanted to share with you that young women of childbearing age, are also more prone to the alcohol toxicity. And that is also something that I wanted to make all of you aware, for you to be able to decide what you want to do to look after your liver. Thank you.